we're going to talk a little bit about abbreviations and equivalents you're going to see next week when you start doing medications. Medications are abbreviated meds. The orders are written on the doctor's order form and transferred to the MAR, or EMAR, which is what you use to give medications. MAR is Medication Administration Record. EMAR is Electronic Medication Administration Record. So let's take a look at an order. Lasix 20 milligrams, Q 6 hours, PO. So this is a pretty good order. You have Lasix, that's the name of the medication you will be giving. You have your dose, which is 20 milligrams. You have your time, and you have your route. So, Q means every, and you have PO, which means by mouth, which is a good thing because most patients like to take most of the medication by mouth. So you know that NPO means nothing by mouth, so you don't want to give anything by the mouth when the patient is NPO. So you have a complete order, you have a drug, you have a dose, you have a time, and you have a route. PO medication are often given in the form of a tablet, tab, or capsule, cap, or liquid, LIQ. But these things are not always guaranteed to be POs. Sometimes you'll take a capsule, put it in a special device, pierce it with a pin, and the patient will inhale the medication that is in the capsule. That is an inhaled medicine, not a PO med. The most common way to give most inhaled medicines is with an MDI, or meter-dosed inhaler. Some tablets are actually given sublingual, SL. They are not swallowed. They are given under the tongue. A big one you'll give all the time is nitroglycerin. Sometimes something looks like it's a liquid that they should just swallow, but it's actually a swish and swallow, where they have to swish it around in their mouth before they swallow. Now let's talk a little bit about milligrams. Milligrams is abbreviated mg. So 1,000 milligrams equals 1 gram. This goes both ways. But how do you know how much to give? The order tells you the dose. The label will tell you how many milligrams in one tablet. We're going to talk more about how you actually figure that out algebraically when we get to that part. Okay, so how many milligrams is in a tab? You're going to read the label on the bottle. Depending on the medicine, this will say milligrams per tablet, or if it's a liquid, it will say milligrams per milliliter. Here is another abbreviation. Milliliter, ml, 1,000 milliliters are in 1 liter. Now we don't give liters of medication, so to speak, but we do give liters of fluid, IVs, that run into the patient's vein if they are, say, dehydrated. It's very common to give 1,000 milliliters or 1 liter of normal saline. So let's talk a little bit about liquid medications and fluids. Often in the community, well, usually in the community, you're not giving liters of fluid, you're giving tiny amounts of medication that have to be carefully measured. One of the abbreviations you need to know is 5 milliliters equals 1 teaspoon. And then you need to know that 15 milliliters equals 1 tablespoon. Now this is easy to remember because on every medication cup out there in the world, they'll have 5 milliliters equal 1 teaspoon. 15 milliliters equal 1 tablespoon. The cup will also tell you 30 milliliters equals 1 ounce, OZ. So you've learned milligram, 1,000 milligrams are equal to 1 gram. You've learned milliliters, 1,000 milliliters equals 1 liter, and you'll talk more about this later. But you should also know about kilograms. A kilogram is equal to 1,000 grams. Now we don't give kilograms worth of medication or 1,000 grams of medication, but you need to know this because 2.2 pounds equals 1 kilogram. Why is this important? Because people will come in and say, I weigh 180 pounds. And you'll be giving meds based on milligrams per kilogram of body weight. And you might be doing this based on milligram per kilogram per minute of body weight, which gets a little bit more tricky. Microgram is abbreviated mcg. 1 microgram is equal to 0.001 milligrams. 1 microgram equals 1/1000th of a milligram. And one more way a few meds are measured is in MEQs, or so many milliequivalents. Potassium is often given as 20 MEQs in 1,000 milliliters of normal saline. Some medications have to be injected. They're injected through different routes. What does that mean? That means where in the body does the injection end up? In the subcutaneous tissue, maybe? Subcutaneous is abbreviated SQ, or sub-Q, or SC. You can inject meds into the subcutaneous tissue. You would inject deeper into the muscle, which is abbreviated IM, or intramuscular. So you would have your syringe with so many milliliters of fluid in it. Syringes are almost always graduated in milliliters. But occasionally you'll be giving medication based on number of units. Unit is never abbreviated. It is always written out. One of the medications you will give all of the time with units is insulin, and that syringe will actually be graduated in units. Another way medications are given are into the vein, or intravenous, or IV. So we have this patient's arm here, and we have an IV cannula that's in the person's veins that we don't always have to keep sticking them. We will connect our syringe of medication, or our tubing going to our big liter of fluid, into the adapter, or top of the cannula. Sometimes the fluid is running in really slow, just fast enough to keep the vein open. KVO, usually 20 to 30 milliliters per hour. IV has a few different subcategories: IV push and IV piggyback. IV piggybacking is where you piggyback a bag of medicine into the IV main line. Piggybacks can run in over 20 minutes to a few hours. That way the patient doesn't get the medication so fast that it hurts them. IV push is misnamed. Rarely do you ever just push. You almost always inject slowly by so many milligrams per minute. Vancomycin 1 gram IV Q 12 hours. You need to look this up and know this is given IV piggyback. Note that order said IV, not IV push or IV piggyback. If you inject vancomycin by IV push, you will kill the patient. Some other abbreviations you will see all the time are R, or, per R rectal per rectum, vaginal, SUPP, suppository, usually rectal or vaginal. Drop is still sometimes abbreviated GTTS. As far as timing, AC is before meals, PC is after meals. When you see BID, think bicycle, BID twice a day. TID, think tricycle 3 times a day. QID is 4 times a day. BID does not equal every 12 hours. That would be written as Q 12 hours. BID is usually 9 and 5. You just have to ask at orientations. HS means hour of sleep. And one last abbreviation that you might still run into, it is left over from the apothecary system and won't die, is grain. The only one you need to know is grains, GR 10 written with a Roman numeral X. GR with an X is equal to either 600 or 650 milligrams. Yep, either one.